Hello team, GCAZ Services is about to start their open enrollment for benefits effective October 1st. We want to thank everybody who participated in the employee engagement survey and follow-up survey regarding benefits a few months ago. GCAZ Services listened, and as you learned in the last video we sent a couple days ago, they took the information you offered and are excited to announce the following changes effective October 1st for the 2024-2025 benefit year. Starting October 1st, all employees, full-time or part-time, will receive a telemedicine policy paid for by GCAZ Services. This not just covers yourself, but covers your children, spouse, domestic partner. It allows you to speak to a doctor via video conference. If you're not feeling well, you got a rash, you need a prescription on something, at least it gives you that opportunity to call someone, get an appointment, which doesn't cost you anything for that, and they can call and get a prescription in for you. Now, the only criteria is you have to be with the company 60 days or longer to be covered. And again, this is for full-time, part-time, all employees, their dependents, and paid for by the company. As of October 1st, we are going to be moving medical and dental insurance carriers to Cigna. With that move, there's some changes. Cigna offers two health plans, a copay plan and an HSA plan. The copay plan allows you to go to the doctor for a copay, a specialist for a copay, urgent care center for a copay, prescriptions for a copay. A health savings account plan, there's no copays. Everything goes towards your deductible at a contracted or discounted rate that Cigna has with the insurance company. The benefit of the HSA is you're allowed to put extra money away into a health savings account. That money you put into that account is put away tax-free. It rolls over from year to year. You pay for services out of that account with tax-free dollars. That means you're not paying FICA, federal and state taxes on that money. But at least you can use it for yourself and dependents, even if they're not on your health insurance. Now, with that plan or the copay plan, you get free wellness. What does that mean? You go in for your annual pap smear. A man goes in for a prostate exam. Women at a certain age, a mammogram. Colonoscopies at a certain age. Your full lipid cholesterol test, things like that. It costs you nothing as long as you see a provider on the plan, as long as you see it's coded as wellness. It costs you nothing. Now, if someone met any part of their deductible from January 1st to September 30th through Blue Cross with the group plan now, you're going to receive deductible credit. We will pull a report from Blue Cross. We will get it submitted to Cigna. You won't see that until mid-November. So if anybody has a deductible that has been met before and has services prior to this showing up, please get a hold of me. Second, anybody in Maricopa County or Pima County will have an opportunity on a smaller network as well for the HSA. That's through a network called Local Plus. That does not cover the Banner system. So if you see a Banner provider, you might not want to go on that plan. But for anybody throughout the state want to go on the OAP plan, you can. The OAP plan also covers the Mayo Clinic. Now, with that said, regarding dental insurance is going to be offered. Dental insurance is offered to all employees that are full-time. We're going to offer two dental plans, a PPO and a DHMO. A DHMO gives you a smaller network of providers. You must choose a dentist from that network, but one will be assigned to you in the beginning. And it's going to be assigned to you based on zip code. A list of copays it'll be. If you want to change your dentist, you can, but you must call Cigna directly. The PPO, which is called DPPO, is a much larger network. You get 2 free cleanings a year, 12 months apart. With that said, if you need a basic service like a filling, it's covered at 80-20, which means you pay 20% of the contracted rate. Majors covered at 50-50. You pay 50% of the contracted rate. You get $1,500 benefit per calendar year, no ortho coverage. But please understand, with the dental, there's 3 deductibles per family. On medical insurance, there's 2. So if you decide you want to cover yourself on medical and yourself and children on dental, you can. But please understand, if you do have to meet the basic or major services, you will have that deductible first. And that's a calendar year deductible. So it resets just like the medical January 1st. Let's go back to the medical insurance. We know that deductibles have risen over the last 20 years quite a bit. As a company, they provide everybody who signs up for medical insurance a hospital indemnity plan for them at no cost. That hospital indemnity plan will provide you $500 if you're admitted overnight, $1,000 if you're in intensive care, as well as an additional daily benefit if you're in the hospital longer than that 24 hours. This costs you nothing. If you have any dependents on your medical insurance, there's a small fee involved that you must cover them on the hospital indemnity. There is only one pre-existing condition on the hospital indemnity. One cannot deliver for 9 months on the plan. So if you signed up last year, you received this last year, you're going to deliver in November, you're covered. If you're signing up for medical insurance the first time now and you're pregnant, you're covered on the medical insurance, but unfortunately the hospital indemnity would not be covered until 9 months you're on the plan. That money that goes paid is the hospital indemnity pays you directly, and this is from Equitable. There's a claim form you must fill out, which is on the benefit website, or you can always call or email me as well. Vision insurance. We use a company called Equitable, but Equitable uses the VSP network. You have no ID card. Your social security number is your ID number, but always confirm your provider that they're in network, just like the medical and dental. VSP is a nationally known network. There's regular eye doctors in the town, but mainly larger chains. You get an eye exam for a copay, glasses or frames for copays, a contact for a copay. But I always tell people, get the eye exam. Worst case scenario, you can always go to glasses.com, Warby Parker, Target, and Costco for another pair of glasses. It's always good to have 2 pairs just in case the one breaks. We offer disability insurance as well, short-term and long-term disability. Short-term protects your income after 15 days. When you're first eligible, there's no health questions. If you sign up now and you wait before, well, you'll have to fill out a health form. That is called an evidence of insurability form, which can prevent you from getting covered if you have a pre-existing condition. Let's go back to pre-existing now. On the short-term disability, there's a 12-month pre-existing condition. That means anything you've been diagnosed or treated for in the last 12 months would not be covered for 12 months. Once you're on the plan longer than 12 months, it's covered regardless of what the pre-existing condition is. Now that's for short-term and long-term. Long-term kicks in after 6 months. Well, the reason why the short-term benefit's a 15-day waiting period, which would pay you for 6 months. The long-term kicks in after 6 months and pays you 5 years for an accident, 2 years for an illness. If you decide now to sign up and you waited before, or you want to increase your benefit because you have a pre-existing condition, you'd have to fill out an evidence of insurability form and they might deny you. So please get in touch with myself or my account manager, Lisa Pettit, to discuss. Another benefit that the company provides is life insurance. We have 2 different policies. The first policy that we have is an employer-paid policy. For all full-time benefit eligible employees, they get a $15,000 benefit. $30,000 if, God forbid, you pass away in a car accident. Now, with that said, we must have a beneficiary. Name, relationship, a cell phone, an address would be great. Date of birth would be great. Social security number would be great. With that, the beneficiary, you can always leave it to multiple people, but you have to do it by this percentage you want to give. Now, we also offer voluntary life insurance. On the employer paid, there's no health questions. On voluntary, the first time you're eligible, you can get up to $150,000 of a death benefit. If you signed up for it last year and you purchased, say, $25,000 and want to increase it this year, you'd have to fill out the health form. As well as if you'd waived prior, you'd have to fill out a health form. But gives you that opportunity to get a guaranteed issue policy when eligible. I can never get life insurance again because of my pre-existing. So if I worked at GCAZ services, I can get 2 policies, one employer paid and one voluntary the first time I'm eligible. I can also cover a spouse up to $25,000, but I must have $50,000 or more. I can also cover children up to $5,000. Children can be on my policy up to the age of 26 years old. All benefits information is going to be in your yellow binder, tab 10. Now, my name is Lee Silverman. I've been Great Clips insurance agent for the last 28 years. My phone number is 480-621-3642. You can always email me at lee@sb-ins.com, as well as my account manager, Lisa Pettit. Lisa can be reached at 480-621-3644 or lisa@sb-ins.com. If you do call or email us, please give us as much information on a voicemail or email, your name, company you work for, your cell phone, what can we help you with. Now, please keep your eye out for the next couple days for emails from Employee Navigator, as well as Lee at SB-INS. And again, if you have any questions, please give us a call. Thank you and have a great day. Bye-bye. $59.5, you can take it out tax-free and do whatever you want with that money.